If you have questions about induction, we have 10 tips for you from a birth doula and a labor nurse/student midwife to help you feel more confident going into induction or potentially deciding whether or not you want to be induced. Hey, I'm Gina. I'm a birth doula and currently pregnant with my fourth baby. And during my first pregnancy, I was sort of induced and I was talked about getting induced by my provider. So this is something that's near and dear to my heart. And so these top tips are things that would have been really helpful for me during my birth.
And I'm Roxanne. I'm a labor and delivery nurse and student midwife. And I've supported a lot of inductions as a nurse.
So let's dive into our top 10 tips of things to consider if you are getting induced. The first is to ask questions. So if you are unsure why you are being induced, if induction is the best option for you, like you're feeling a little anxious or unsure about induction, the first thing to do is ask questions. And so one way that we can ask questions is with the acronym B.R.A.I.N, which means benefits, risks, alternatives, intuition, and then nothing. And so you can use that to help you figure out some information to help you make an informed decision. So first, what is the benefit of being induced right now? What are the risks of being induced, but also what are the risks of not getting induced? What are alternatives that I have? Do I have other options for testing to monitor my pregnancy as opposed to getting induced? What options do I have for induction? Your intuition, and this is going to be more of like, how are you feeling about this decision? Do you feel confident that this is a good decision for you to either choose an induction or not choose an induction? If not, we have more questions that we need to ask. And the last one is going to be nothing. What happens if we don't do anything? And there are risks and benefits to not doing anything as well, so exploring those with your provider can be really beneficial. But if all of that feels really overwhelming to try to figure out in the moment, because sometimes induction gets like sprung on you suddenly if you developed a complication, if you like are just super pregnant and your provider is recommending this to you, maybe they're recommending an elective induction to you and it can just feel really sudden. So you may be like blindsided by suddenly needing, or there's suddenly an induction being recommended. And so you might be like, I forgot the acronym. What do I do? Tell them how you are feeling. So if you are feeling anxious or you're feeling scared or you're feeling unsure that this is a good decision, express that, because that's usually something that's readily available to us. So, hey, I'm feeling really anxious about getting induced. I'm not sure if this is a good decision for me. I would really like to talk more about induction and I want you to help me feel less anxious about this. And that can be like a really good starting place with asking questions so that you can feel confident about whether or not you want to be induced or if you want to choose some other options.
The second tip is asking your provider their standard induction protocol. So what is their usual when they do inductions? So what options do they normally use, as well as like what order, when would they use it for your situation? And then just going through like what their standard procedure is for that induction can kind of be like the fear of the unknown. You don't know what to expect with it. But also knowing that there's usually some options available if you don't want an induction. There are some options that they can do to continue to monitor the pregnancy to ensure that the pregnancies can continue safely and you don't need to be induced that day. So there's other tests like a non-stress test is where they monitor baby's heart rate along with contractions to ensure that baby in the moment is giving signs of well-being. It's a 20 to 40-minute test where they monitor baby's heart rate with contractions during that time. And then if baby is doing well, then pregnancy can continue for at least another day. The other options are they can do ultrasounds. One of the ultrasounds would be a biophysical profile where they're looking at all of these different things and baby gets scored for having different things like gross motor movements, fine motor movements, or like rolling, their breathing movements, different things like that, as well as your fluid level. And that could include the non-stress test. This is a way to, again, assess how baby is doing in that moment to ensure that baby is thriving and doesn't need to be medically induced for any sort of reason. So that is an option where they can do this test to ensure that, yes, baby is fine right now. We don't need to induce at this exact moment. Pregnancy can continue. Or they might do those tests and be like, oh, actually, like, you probably should definitely be induced. So this kind of helps answer some of those questions as well. That's an option to do instead of needing to be induced immediately and may even be part of their standard induction protocol. But not everybody knows that that's an option.
The third thing will be understanding what your monitoring options are. And this is going to be really helpful for your expectation management. So, if your hospital does not have portable monitors that are wired to a stationary machine, this can really restrict your movement capability and your freedom of movement during your labor. And so, if you're receiving certain types of medication during your induction, you may need to be continuously monitored where the monitors are on your belly at all times. And so you may not be able to go use the shower or use the tub or potentially even go to the toilet. They might bring like a little pan for you to use by your bed. And so understanding the type of monitors that are available can help you with your expectation management. Ideally, if you're being induced, your hospital has portable monitors or Bluetooth monitors so you can still freely move around the room if you have to be continuously monitored. But this can really help with your expectation management of what am I going to be able to utilize for labor comfort during my birth while I'm being induced.
Tip number 4 is that most inductions don't need to happen like immediately. Most of them can, there's some leeway with when that induction can start. And having a cervical exam could be beneficial to kind of decide when you're actually going to go in. If you are 4 centimeters, likely they're going to start with Pitocin for your induction. It may not be beneficial to go in right at 5 o'clock to be induced because you're not going to get any sleep. It could be beneficial to wait till the next morning so you can go home, pack your bag, eat your last meals, as well as have a full night of sleep before going into the hospital freshly rested and fed to get your induction. Or maybe you are 0 centimeters dilated, and it could be beneficial to go in and be cervically ripened. So to get medication to soften that cervix and open it so that you can, in the morning, get some of those medications. But usually the ripening process is pretty uneventful where you're able to sleep throughout the night. So you can get your well-rested night of sleep in the hospital while actually doing something to the cervix to kind of shorten, hopefully, the amount of the induction. And then tip number 5 is ask about your options because some options with induction can be what we call outpatient procedures. So these are procedures that can be done outside of the hospital where you don't need to be admitted. There are induction procedures that some clinics offer where they'll place it in the hospital and then send you home. So these are most of the time cervical ripening agents or like mechanical dilating agents. Some hospitals will allow you to place prostaglandin gels the night prior to your induction to help soften your cervix, but at home, or some will place what's called a Foley bulb in the clinic and then send you home with it. If it falls out, they say, unless contractions start, we'll just see you in the morning. Or they'll place what's called like seaweed sticks. So it's called laminaria or Dilapan S are options where they place these like little sticks into the cervix. So you do have to be somewhat dilated for this option. But they place like little sticks in your cervix and then they expand. But those options are all things that you do at home. So they place it in the office, they send you home, and then in the next morning you show up at the hospital. And usually people are a little bit more comfortable at home, so it makes the induction process a little bit easier. But if you don't know that this is an option and maybe your provider doesn't bring it up, you won't know that it's available to you.
So tip number 6 is to eat before you go to triage. Please eat like a full meal before you go to triage. Some birth locations do have food restrictions where you can't eat any food or you can't eat any solids after a certain point. Sometimes it's right as soon as you get admitted. Other times it's like when you receive a certain type of medication, and it may vary on you depending on the severity of your complication and the likelihood of needing a cesarean as well. But eat a meal before you go to triage and a full meal because you don't know if it's going to be the last meal that you have for a prolonged period of time. And Jell-O is not super nourishing. It is not. Like, you can drink all the electrolyte salts and eat all the Jell-O and popsicles. You're still going to be really hungry if you are going into it already starving. So eat a full meal, something that's high in fat and protein that can help sustain you for long periods of time would be super beneficial. And then you can think about what kind of snacks you want to pack during your labor as well, depending on what you feel comfortable with eating during your induction based on your hospital policy. So things like honey sticks and like energy gels are like a great clear liquid option that's available to you. You can also pack whatever else you want in your bag.
And since we're talking about food, tip number 7 is if your induction is taking a long time, you can always ask for them to take a break so that you can eat, maybe shower and sleep a little bit before they move on to the next step of their induction. So let's say like you got a mechanical dilator. If they placed a Foley bulb, which is placed into the cervix to allow it to force it open in a way. If after that falls out, you still are not like actively contracting and they're wanting to move on to Pitocin or breaking your bag of water, maybe before they do that, you can eat and shower and rest before moving on to that one. And that can help like replenish your energy levels so that that induction can continue. Or like you've been on Pitocin for over 24 hours and nothing is happening. You can ask for them to turn that Pitocin off so you can have a break to, again, eat, sleep, take a shower, feel refreshed and renewed to then continue on in that induction process.
Number 8 is to be patient with the process. As we've kind of been discussing, inductions can take a long time. Sometimes there's a lot of steps to get you to active labor, which can take hours or even days. So being really patient with the process is super important. There's usually not a need to rush to the next step of induction. So taking your time navigating like which option you want to explore next, what other options are available within that realm can be super beneficial. So for example, you've got a cervical ripening agent and you're trying to explore whether or not you want to continue with mechanical dilation. Well, maybe you ask for a membrane sweep first, or maybe you're like, nope, I want to do the Foley bulb. I would like to have the mechanical dilator. Or if the next step is Pitocin, we can also try nipple stimulation or breast pumping to stimulate that oxytocin release before we try Pitocin to see if maybe that kickstarts labor for us. So exploring the different options within each induction step can also be really beneficial to help you feel like you're the one making the decisions, exploring what feels best for you, and just taking your time with it. There's usually not a reason to rush, especially if your water is not broken. There is no rush to induction.
And tip number 9 is knowing the signs of labor progress other than a cervical exam. With induction, cervical exams are going to be a little bit more frequent than active labor because they use those cervical exams to kind of guide what option they're going to give you. But knowing that there are other signs to look for with labor progress can be really helpful, like external signs that you can see in yourself with your temperament, your intuitive movement patterns, like how you're moving and how you're acting during labor are really great indicators of labor progress, more so sometimes than the cervical exam. So it can almost like mess with your mind if they're like, hey, you're only 4 centimeters, or oh, now you're 5 centimeters, but you're like, well, it's been like 4 hours. How have I only progressed 1 centimeter? But knowing that, hey, you've had this big shift in your temperament, or you are now moving in a different way during contractions. So that is a sign that labor is progressing, but that centimeters can like mentally mess with your mind. So knowing what those signs of external labor progress is can be a little bit better than using the centimeters and help with you to know that, yes, labor is happening. Baby is coming. So the ways that we can do other than just the intuitive movement pattern and the temperament changes, but also our contractions. Our contractions are a great way to tell that labor is progressing. And are they getting closer and closer and closer together to ideally be like 2 to 3 minutes apart, lasting for 40 to 60 seconds, depending on the contraction? And are they getting stronger? So they should be increasing in intensity over time as you progress from early into active labor. If they are really strong, they're closer together, this is a really great sign that contractions, like labor, is progressing. If you're feeling your contractions go from like one area, so we usually might feel it like higher up in your belly, and as baby kind of progresses down, you might start to feel contractions lower and lower. That's also a really great sign. So the sensation of the contraction is a really great indicator of labor progress as well, aside from that cervical exam.
And our final tip is to know that you can probably always leave. If your water is still intact, and if it's not a medically necessary induction, you always have the option to leave and be like, you know what, sounds like I need to come back another day. If you are being medically induced, this would be a great conversation to have with your provider before you decide to leave, to figure out whether or not this is a good idea or if there's other options to help monitor baby and you at home or coming into the clinic every once in a while if it feels like the induction is just not going anywhere. So being induced is usually not how most of us are planning to go into labor, and it can happen very suddenly. Like you could almost feel like you've got blindsided by an induction recommendation. Induction is a tool that is available to us that some of us do need for the safety of our pregnancy and our baby. Sometimes continuing pregnancy is not the safest option for us. So being able to explore your options with your provider to better understand why this is a recommendation can be really beneficial to helping you decide whether or not getting induced is the best for you and for your baby. So in summary, our top 10 tips are: 1, ask questions. If you're feeling anxious about induction, get a better understanding of why this is their recommendation. Number 2 is to understand what is the standard induction protocol. What can I expect with this induction? Number 3 is to ask what the monitoring options are available to you so that you have a better idea of how you can use the labor comfort measures in the labor room. Number 4 is potentially have a cervical exam at that appointment so that you have an idea of when you should head in depending on your cervix favorability. Number 5 is to ask about options when it comes to induction, with each step of the induction to include outpatient options. Number 6 is to please eat before you go to triage for your induction, because sometimes it can be a long time before you eat again. Number 7 is if the induction is taking a long time or you're at the next step of induction, asking for a break so that you can eat, shower, or even potentially sleep can be super beneficial to the satisfaction of your induction experience. Number 8 is to be patient with the process. Inductions can take a really long time, but there's usually not a need to rush through all the steps, so be okay with asking questions and to allowing each step of the induction to work for you. Number 9 is to know what the external signs of labor are so that you can limit the number of cervical exams that you get. So this can include understanding there's a shift in your temperament, that there's changes in your movement patterns, and then also changes in your contraction pattern to let you know that you're moving towards active labor. And then our final tip is to know that you always have the option to leave, especially if your water is intact and this is an elective induction. If it's a medical induction, it could be a good conversation to have with your provider if it feels like nothing is happening. So we hope this video was helpful for you to know how to navigate an induction. These are all things that would have been really helpful for me to feel more confident and empowered going into a potential induction during my first birth. And so I hope that they're all really helpful for you. If you have any other tips for somebody who's getting induced, be sure to comment below to let them know so folks that are watching this video can also see your advice as well. If you enjoyed this video, be sure to like and subscribe to our channel so you get notified whenever we release new videos. We release 1 to 2 new workouts every week and 1 to 2 educational videos every week to help support your pregnancy, your birth, and beyond. If you want more support throughout your pregnancy, you can join our online prenatal fitness program so that you can get daily workouts synced to your week of pregnancy or trimester to help you move confidently throughout your pregnancy so you can stay strong, pain-free while you prepare for birth. You can bundle this with our childbirth education course that does include a whole bunch of information about induction and helping you understand the science of birth so it's a lot less mysterious and scary for you. Learn about your options in our childbirth education course and feel confident moving your body during your pregnancy with our prenatal fitness programs. And you can bundle the two to save an additional 15% off and use code YouTube10 to get 10% off. So it's like 25% off. So it's pretty much free at that point. If you're postpartum, we have our postpartum return to fitness programs to help you from birth until you get back to the sports that you love. We want to help guide you through that recovery process so that you feel confident moving your body, knowing that you're not causing more damage or harm.
And if you're a professional and wanting to learn more from us while earning continuing education credits, we have a birth workers course and a prenatal postpartum fitness course that you can check out on our website at mamastayfit.com. And you can use code YouTube10 to get 10% off any of our courses.